I work in a pediatric hospital and I'm a psychologist there. And so I work a lot with families who have some medical concerns or medical adjacent concerns. And a lot of parents want to protect their kids, right? That's a very natural instinct where you don't want harm to come to your children. You don't want your child to be distressed. That is very normal. The reaction of the child is also very normal. It is normal to be distressed in a hospital setting. That's actually a positive sign. It means that your child is processing what's happening and they're feeling comfortable enough to express those emotions. What we often see is that parents want to protect their child by not sharing information about their diagnosis or prognosis. And that's really tough because children will always pick up on something being wrong. And your child probably has a suspicion that something is not right based on how you or other caregivers or medical providers interact. And often avoiding these conversations can bring up shame or fear and kind of close down the avenue for when your kids can ask you questions about it. So even though it's really tough, we always recommend having developmentally appropriate but honest conversations with your child about their medical diagnosis and treatment plan. And it can feel really hard in the moment, but it's a really great way for you to model how to handle really hard news or even uncertain news and how to go on from there and how to cope and how to allow yourself to feel those really hard feelings. So while you might want to protect your child, we know that hiding information from them can actually lead to more anxiety, more depression, because one, they'll kind of assume the worst. They might think they're dying, even if they're not, or if they are dying, they might not feel like they can talk about it with you. And so we just really encourage open and honest conversations, and psychologists in the hospital or child life specialists, sometimes social workers, can be some really great resources that can help you navigate these really, really hard conversations with your kids.